Morning, everybody. Thank you to all you guys that helped making the subs this morning. Not many, but you did a great job, did it quickly. We really appreciate it. We're really happy to have interim with us today. And I just love saying this. This is Terry, and this is Carrie. I love doing that. I get to go. Terry and Carrie. Whenever you use this, you have to hold it pretty close to your mouth.
Oh, okay.
Just so you know. They are doing a really cool presentation. I got to experience it last week at Canadota, and it's pretty cool. It's called I always want to say REKOVO. It's called REKOVO, and they're going to explain it and talk to you about it and really get into detail as far as how innovative that this is for all different reasons. Then they're going to ask for some volunteers to actually see it in use, see it in motion. And I really hope that we get some volunteers to do it. We had about maybe roughly half the folks at Canadota. We kind of ran out of time, to be honest with you. They really enjoyed it, so I think you're really going to enjoy this presentation. And Terry, are you kicking it off?
I'm kicking it off.
Okay, I'm going to turn this over to Terry.
Hello. Thank you guys so much for having us today. I really do appreciate it. Like Patty said, we are Interim Healthcare. We are a home health agency here in Meadville, Pennsylvania. We do both skilled and unskilled services in your home. And what I mean by that is if you maybe just come home from a skilled nursing facility or a hospital or a rehab, or maybe you go to your doctor's office and you're just not feeling yourself, you're having some balance issues, maybe you've got some new medication that's kind of confusing, we're the folks who come into your home and help you get straightened out for a few weeks. Paid for by your insurance. We just have to have a physician's order for that. But that is our job, is to come into your home and make you stay at home as long as physically possible. We also do the unskilled business, which is having home health aides come into your home and maybe do some meal prep, some education, med reminders, light housekeeping, taking you for errands and things like that. That's our other side of the business. Carrie and I come from the skilled side of the business. And I'll let Carrie introduce herself. Like I said, my name is Terry. I'm the transitional care coordinator, and it's my job to get all those services set up for you. I actually go into the facility or to the doctor's office or wherever to get those services set up for you. And I'll let Carrie introduce herself.
Good morning, everybody. Morning. How are you? I'm Carrie. I am the physical therapist with Interim Healthcare, and we're happy to be here. This is the last of six presentations that we've done in Crawford County at the active aging site. So yeah, it's been fun. I think this may be the only place that I don't see a familiar face. That's a good thing, because you haven't needed me.
It might happen if people glasses out.
Let me see.
It might happen.
Has anybody here had physical therapy in their home before? Okay, only one. That's a good thing. That means you haven't needed it. So welcome. Today we are going to tell you about REKOVO. Okay, it has another name. Sometimes we call it agility art. REKOVO is kind of difficult to remember. So if at any time you have questions, let us know.
Okay.
So like Carrie alluded to, REKOVO is actually agility art. It's using art to do therapy. Very unique concept. It's being very well received at this time. It was actually created by The Ohio State University Hospital in the hopes of finding a different way to present therapy that wasn't the same old, same old. It's used as part of any comprehensive therapy program. I always like Carrie to kind of talk about how it's helped her with her therapy stuff. It is a new and innovative technology. We're still on the forefront of this. It's very young, but there was enough study and enough data for them to actually present it to organizations such as Interim Healthcare to add to our therapy package. Some of the places, some of the things that we're using it for, we're going to have slides. We're going to talk a little bit about how we're using it. So that's what we're going to do today. The thing about this type of therapy is it must be initiated by a licensed therapist. So either a physical therapist, a physical therapy assistant, an occupational therapy, or an occupational therapy assistant. It must be physician ordered, and for this, it's being done in the home right now, but we can also do it in assisted living facilities and things of that nature. This is part of a neuromuscular restorative rehabilitation using visual biofeedback. When you've performed the art, charts and graphs come up, and we'll show you guys exactly what we mean, to get instant feedback on how it's working. There's goals that you're going to try and meet, and each week, each visit that you have with Carrie, she's going to work on the next goal, and you get to see that day whether or not your goals are being met, if things are changing, and you get pretty art. This is the part that I like Carrie to talk about. It's not the only skill that we're performing in the home, so I'll let Carrie elaborate on that by what I mean.
So you've had therapy in your home. Has anybody else had a hospital stay or rehab stay where you've done therapy? Inpatient. Okay. So as a physical therapist, we have goals for you. Normally those goals may be strength, endurance, balance. Those are the big groupings of what goals we set for you. And I'm sure if you've had therapy in your home or in a facility before, you've done the exercises, okay? We call them our bag of tricks, okay? So we may be doing things like seated marching, kicks, range of motion exercises. The REKOVO gives us just another tool in our bag to help you, okay? That kind of gets away from the norm of what we've always done. And people are really liking it, enjoying it, because it is different. Gives us something different to look forward to and not the same old that we've always done.
So let's take a second to kind of explain some of the things that we are using it for. One of the things we're using it for is patients who come home after knee replacement. We're using it for balance. We could all use it for balance. We're using it for range of motion, strength training, and also we're using it for activity tolerance. There is a timer that we set. It can be set from 1 minute to 15 minutes. And as we gradually do it, we don't expect everybody to be able to go for the whole entire time. Sometimes you can only do 30 seconds. So then maybe your next goal will be next time be able to stand for 45 or keep going and going and going. That's part of the goals that we are going to work on. Very first time Carrie comes out, she might say, I want you to do this for 1 minute, you last 15 seconds. So that is one of the things that we do with our knee replacement. Hip replacement, kind of the same idea, balance, range of motion, strengthening, and activity tolerance. How long can you do it for? Ischemic stroke. If anyone has had a stroke, there are always deficits that are possible with a stroke. We work to try and get some of those deficits back. We work arm, hand, my favorite, the hula hoop. We can actually put it around your waist. This art is very, very mobile. We're going to put a sensor on you with a strap in a location that we're trying to work on. I know it sounds kind of out there right now because we're just explaining it. When we actually physically do it, it will make total sense. We can put it on many different body parts, many different size straps for us to do this. And also with ischemic stroke, some memory and cognition. With memory and cognition, sometimes people who have a deficit can remember things from their past and not what happened from week to week. Carrie's going to talk about this a little bit more when I get to the Alzheimer's slide, but just so you know, we can work on cognition. We can put a picture on the screen and have you work towards revealing that picture. And maybe it's something from your past that you'd like to see again. And like I said, we'll get more into that when we talk about the Alzheimer's slide. Neurologic neglect syndrome. I usually turn this part over to Carrie because she is a clinician, so I'll let Carrie talk about neurological neglect.
So we often see neglect in our patients, mostly with strokes. And when we think of a stroke, we think of usually one side affected more than the other. With that, we see not only weakness, loss of range of motion, but also visual deficits, and usually affecting one side versus the other. The REKOVO has given us the capability of working in that direction, doing fun things when normally, we're struggling trying to get people to focus on that side of their body, to work on the range of motion, strength, balance, forcing them to go that way.
Thank you. Parkinson's disease. If you're familiar with this disease, there is oftentimes neurological issues with this, such as balance and fall, but also too the shaking. A lot of people are a little more familiar with, when you think of Parkinson's, of thinking somebody who's got shaking that's going on. This Agile art kind of helps limit the amount of shaking, has you concentrating on something else other than what you're trying to do, your task. So it kind of gives you a little bit of an outlet to utilize what your body's trying to do. So that's one of the things that we do. Upper and full body, we're trying to work on strengthening and exercise. Here's another one that's a big deal, is a lot of times people will go home with orders for cardiac or pulmonary rehabilitation after some type of an episode. If they have COPD, chronic obstructive pulmonary disease, or congestive heart failure, they may go home with orders to do some type of cardiac or pulmonary rehab. Maybe you had a really bad bout with pneumonia, and the doctor wants you to go home and strengthen those lungs. REKOVO is a technique that our physical therapy assistants, occupational therapy, and occupational therapy assistants can work on to get your lungs and your heart going for rehabilitation purposes. It is a workout. Don't let it fool you. Has anybody ever done Wii bowling? Okay. Afterwards, you got some muscle soreness, right? You get your heart rate up there a little bit, especially when you're getting mad because you keep throwing gutter balls instead of strikes. But it does get your heart and your lungs moving.
The other nice part when we're talking about endurance, whether it be cardiac or pulmonary, this can be done, either seated or standing. So if we have not progressed to the ability to stand, even if it's at a walker, an assistive device, counter, it can be done seated. And part of the way we judge how you're progressing is by the time you're able to stay in that position. So it is nice that we can work with all aspects of care, whether it be from seated position and progressing to standing.
Thank you. I think you're next. Yep.
As far as the post-chemo neuropathy, balance is a big issue, and not only just chemo neuropathy, diabetic neuropathy. Often we see a loss of sensation in the feet that affects balance immensely. Okay, your balance is affected by the sensation in your feet, the strength in your legs, your vision. Just opens up a whole nother opportunity of working to challenge your system, again, whether it be seated, standing, both feet, single leg stance, so many opportunities to work on it. And then we have the Alzheimer's, which Terry alluded to a little while ago. As you'll see, there are different ways of running the REKOVO or agility art. There is a free draw that we'll show you, and then there's also an aspect that we call uncover, okay? So these types of folks can be especially challenging working with them, because some of them don't even understand why we're there or what the goal of our treatment is. So as we'll show you, we can kind of tailor this treatment to them. Instead of going in and saying, hey Joe, good morning, let's do our exercises today. And they say, Carrie, I'm tired of doing exercises. Why are we doing this? We can tailor it to them, and we'll show you examples of that as we go along.
One of my favorite stories I always like to interject here in the Alzheimer's dementia is there was a gentleman that we were taking care of, and his family lived in California. He lived here. every month his son would send him a thumb drive, and everybody knows what a thumb drive is, right? You plug it in your computer, full of memories and pictures of the whole month that he captured of his wife, himself, and the 2 children.
Oh my goodness.
Now, Dad loved to get these because it was like kind of like going back and reading a diary for an entire month of what was going on with his grandkids and his son and his daughter. And every once in a while, his daughter-in-law, would come visit and they would do things together. So he'd have pictures of exactly what they did. And suffering from dementia, he recognized his children, his grandchildren, but maybe, again, couldn't remember to take his meds that day. So one of the things that our therapist did, and I don't mean to say to trick him, because he was all on board with this and agreed, is we would put in that slide, or his thumb drive, and we would make him reveal the pictures. So it kind of became a game with him. It was something he loved to do. He loved to go through and look like at the video diary that his son had created him, but we're putting it with a cover-up, and he's got to uncover it to see it. So it helped him reach his goals because he wanted to see those pictures so bad that he was willing to do the art. So that's just one of the fun stories that I like to tell, and he did very well with that. So we've talked about it. Now let's go check it out and see how this thing really works. So Carrie, if you want to take a second to get your thing ready, I'm going to shut off the microphone for just a second so I can set it down.
This is pretty much all done with a sensor, and can be used multiple ways. If you're using it in just the hand, it can be held. We have, like Terry said earlier, all kinds of Velcro straps. It can go on a wrist, an arm, even the waist, a leg, to tailor the treatment that we need to do.
So you see here, this is a web-based product. Each one of us has a login. It's a secret login, completely HIPAA-fied so that nobody else can get to it. I, because I'm not a clinician, do not have access to any patients. Carrie, as a clinician, has access to the patients that she takes care of. And every time that she goes in here, she can load her patient in so that it's tied directly to the chart. Everything's done electronic charts nowadays. So it's gonna tie right into the chart. So this will go in your chart, which is really neat. So we come in here, and basically we're going to choose a client. Now I'm gonna choose Jolly Roger today. You can see that Jolly Roger and I have been working for some time, because typically we have about 12 visits, right, Carrie? Somewhere around that ballpark. We've already worked together 7 times, me and Jolly Roger. I could go back and I could look at all of our previous things to see what should our next goal be. And I'm gonna sit down with Jolly Roger. I'm gonna say, hey Jolly, last time you were able to stand for 1 minute. Can we try standing for 1.5 minutes this time? So again, we can work on and progress through these goals. Now I'm gonna choose what kind of art I want to do. Like we said earlier, there is a free canvas, which is just basically painting with polka dots. It's a really cool technique. That's the one we're gonna show you first. There's also that thing I told you about, the reveal, where I can load a picture, any picture, I can even choose artwork from the internet, and cover it up so you can't see it, and then make you scratch it off like a scratch-off ticket.
Oh my goodness.
So that's really a neat technique, like I said, especially for cognition, because that gentleman I was talking about, if he couldn't uncover a picture, you better believe the next time that we went back, he would remember that he's already seen the left half, he needs to concentrate on the right half, so it's kind of neat. But we're gonna do free canvas first, so give me a second here to get that set up. I also can change the colors of exactly what color I want to use. And since today is so cold, we're gonna pick the beach. So I'm gonna set it up for a beach scene. You can see the water, the sand. Like I said, you can change the duration. How long can you do this for? So we're gonna set it for 1 minute to be easy on Carrie since she's going first. I just leave the mouse speed at normal. It doesn't need to be fast or slow. There are 2 different effects I can do. I can do 1 single paintbrush, so just 1 stroke and you're on, or we can mirror it. so that what you do to the left side also happens on the right side, exactly the same. But we're gonna leave this as a single one. First thing I'm gonna do is I'm gonna go ahead and begin my session. Carrie, the physical therapist, is gonna hook you up. She's gonna put her straps on, or she's gonna put it around your waist, whatever you guys are working on. And when it's time to begin,
So let's set it up real quick. So let's say I've had a stroke, and I don't stand very well, and actually I'm doing this for purpose, so I'm not standing in front of everybody right away. We're gonna do it sitting, okay? And we're gonna.
Sure,
my
Carrie.
goal for today is to work on range of motion of the right arm, okay? So
it's off. It's on.
So we will, can be done in a variety of ways, but I will have instructed you what we're going to do, and then, so what I'm telling the patient here is to try and move your arm up and down, okay? Maybe they need some help. Maybe they can't do it actively on their own, and I'm helping them, okay?
I'm going sheep.
It is kind of like painting your walls.
So then, at the end of the session, and I may not have even been able to do the full 1 minute. That's something we can qualify and quantify afterwards and try to improve our endurance with our movements. At the end of the session, you're going to get a table that looks like this, okay? This first set is going to tell you how active you were, okay? You're getting a percent. I was only active for 18% of that minute.
Okay.
Again, we can use this as a tool for next session to try and improve that 18%, okay? This is telling me where in the screen we made our dots, okay? And again, if we're looking at how high we can get that arm, we want to aim for higher next time. The speed, we don't get too hung up on speed just because usually our goal is not to see how fast we can go, but to work on the other areas. And again, the time spent. And maybe we didn't spend the entire minute. We had to sit down and take a rest, but all give us good, clear parameters for next visit.
And you can see we've had some really good days and we've had some really bad days on Jolly Roger. We've had some peaks and we've had some declines, but this does help to show us where we're at and where we're going with our goals. Now, some of you may be wondering, how do they get this in my house? How do they use this in my house? Fear not, we do come equipped. All of our therapists do have a computer, very much the size of mine, so that they can actually use their own computer. They do not have to connect to your Wi-Fi. We do actually have our own Wi-Fi that we bring with us. Now, it would be nice if you would allow us to use your nice big screen TV. It means you're gonna have a better, clearer picture. It's gonna be a little easier on the eyes. And also, if we can connect to your Wi-Fi, if you don't mind us connecting to your Wi-Fi, it's obviously gonna be more stable because it's in your own home than us having the portable one. But you do not have to have a TV, and you do not have to have a computer or Wi-Fi in your home. We bring it all to you. So don't fear that. I just wanted to let you guys know so you didn't worry, how do we get this into your home? It's very easy. So let's go back and let's create a new session. This time we're going to do a mirrored image, where, like I said, the left and the right are going to do exactly the same. We're still going to set this time for 1 minute.
Where do you want me to put this one?
Leg.
On my leg. Okay. It's going on your leg.
That's good. I need some PT on my leg.
Hey, we got a volunteer, Carrie. Did you hear that? We know Merle's volunteering. He's already promised.
We're all volunteers for everything.
We're lucky
Trying to get
then.
everybody else to volunteer for them.
All right.
Get you.
So Carrie and I have decided that we're going to do the free canvas. We're going to do a unique color pattern that's a little darker. We're going to go normal speed. We're going to mirror our image. So we're doing the same on the left and the right. I would hit to begin the session.
So this one, let's say we're going to work on some balance, okay? So I've got the sensor on my right below my right knee. And I'm going to tell my patient we're going to do some stepping out to the front, to the side, and back, okay?
I'm going to hit begin, and away Carrie will go.
So I will cue my patient to work on some balance activities, okay, whatever they may be. And as you can see, it's kind of mirroring on both sides.
Yes.
I can say, okay, let's maybe do some marching while we stand. It doesn't always have to be trying to cover the whole page, okay? Every picture is going to be unique.
My goodness.
And believe it or not, we can print these out for you and you can keep them at your house.
Oh my goodness. Just like that.
Just like that, 1 minute.
So again, if we're going to compare sessions, which we wouldn't really be comparing an arm with your leg, because here we had 18% and then we did 65 was our percent active on this one. We would be, if we were working different things, say I was doing upper body stuff one day, lower body, I would actually make you 2 accounts so that we could keep them separate to know what we were working on. Coverage, again, not huge for this one because of what we were working on, the balance, okay? And speed and time again.
Does anybody see Merle?
Merle has left the building.
Oh, darn it.
He knew it was time.
Yeah, I just get into that time.
Probably getting loco.
I was going to have him show you guys how it's done. So if we could have a volunteer,
Well, I think
we
we
would
already
love to
have-
show
I think we have
somebody.
one.
Oh, that quick. Thank you very much. All right, so we're going to have a volunteer come up and we're going to actually do the reveal art.
On your arm? Yeah?
No, I'm not. I don't.
Okay.
It's okay, honey. She just won't throw it real quick. Okay.
How about we put it right on your wrist? Get rid of that. All right.
Yeah.
Okay. So let's back up this way a tiny bit. Let's go between these 2 tables. You're okay here. Yep.
Stop.
You're all right.
You're fine.
You're gonna sit?
I guess.
All right, perfect. So I want you to try and cover all that screen as much as you can with the dots and the color. Can you do that?
Okay. Yeah.
Okay. All right, have at it. We're gonna move your arm. There you go.
Okay.
See how moving the arm? Let's go this way. Good job, Judy. There you go. And you're actually doing a reveal. So there is a picture under there that we are trying to reveal this time.
Just like that.
Great job. Yep.
That's amazing.
And then again, it's telling us how much of the screen we covered, or uncovered actually in this case. And next time we can shoot for trying to uncover more to show that picture. Now if you say what do you like to do in your free time?
Keep it G, Judy.
What'd you say? Keep it G. Keep it rated G. What do you
She likes
like?
to play pool.
You
Pool.
like to play pool.
Yeah.
All right, so I could download a picture of a pool table, put it right on there, and you'd have to uncover that picture. And
Okay.
you'd say,
Yeah.
it's a pool table.
Okay.
Something that you like, okay, to make it a little more fun instead of that person.
Yeah.
Okay?
Holly Princess.
Yeah, Polly Princess. She's another one of my favorite clients.
Good job, Judy.
Yeah.
Thank you.
Thank
I really appreciate it.
Okay.
Would someone else like to come up and do it?
There's Merle.
Merle, are you available to do the art real quick for us?
I got one for you. Merle, do you like to hula hoop? Do you like to hula hoop? Do you like to hula hoop? Okay.
Wait,
He does dance and everything. He'll be dancing tonight.
I already heard about a Valentine's Day dance. What kind of music do you like to listen to? Me too. All right, I gotta give you a hug. How did I know that? Perfect. There's your sensor. All right, look. Let's do a bright colored.
I did muted.
Okay, we're good. All right. What's he doing, revealing or?
Nope, he's doing free art.
Okay, so I want you, we're gonna turn you on. Now, shake it. Watch. Look over here. Look, you're trying to make a picture with your sensor on your stomach.
Shake it like Elvis Presley.
There you go. Okay.
Yeah, keep going.
1 minute.
You got 1 minute.
Ew, what kind of picture can I make?
I think you went off the screen. There you go, you're back. That's a great picture, Merle.
Good picture?
Look.
No, done.
Whew.
Good job, Merle. Good job, Merle.
Was it doing good? Not doing good?
You did
You
great.
did very well.
Yeah.
Not doing good.
So we could get you dancing in therapy.
Was that, I think silver sneakers here
Silver sneakers.
twice a week.
It is twice a week, yes.
And they go dance now Thursday night.
Okay.
Every week.
Sounds good to me. Thank you.
Done?
Yes.
Do we have at least one more volunteer that would like to try it? Anybody?
Anybody want to?
We can let you sit. You can sit if you want. Nobody else? Last call for volunteers.
I got one. We got to make a picture? You want to put it on where?
I don't care whatever you're doing, I'm fine.
Whatever you're doing, I'm trying.
You want to try it on your leg?
Oh my goodness. I'm fine.
Ready?
Move that leg up and down. Maybe you do some marching.
Where am I going?
You have to move your leg.
That's right.
Yep.
That's that. Ooh, la, la, la.
So let's lift your leg up and down.
Ooh, la,
There you go.
ooh, la, la.
It's beautiful.
Oh la la, oh la la la, oh la la la, oh la la la.
Look at that picture you're drawing.
Oh la la, oh this one, this is one.
Yeah, the right
Oh
one.
la, so oh la la, oh la la la, wow, oh la la, oh la la, oh la la, oh la la, oh la la.
Very good. Look at that. 85% of the time you were active. Wow. Very, very nice.
Thank you, ma'am.
And it's fun. Again, something new, something different than just doing the same old arm exercises, leg exercises, which is really, really nice.
And of course, you know, we're having fun with it today to show you. We, as the therapists, tailor it to what our goals are for you. You know, maybe doing a dance or line dancing would be one of our goals as far as some just standing balance, endurance, that type of thing. So we're tailoring it to what works for you and what we're looking for as far as goals for our therapy session.
Does anybody have any questions for myself or Carrie in regards to Agile Art or REKOVO?
I do a lot of those exercises you're doing in my exercise class.
A lot of the same exercises are being done in your exercise class?
Uh-huh.
Standing on my
Yes. Yeah, and you know, those exercise classes are very, very good for you. Okay, they obviously, when I discharge people from therapy in their home, my hope is that you will continue with those exercises. Sometimes it happens, sometimes it doesn't. So going to a class definitely helps keep you motivated to do those things, yes.
Thank you guys so much for having us today. I really appreciate it. If you guys have any other questions, Carrie and I will be here for a little bit, tearing everything down. We'll be more than happy to help you guys, okay? Thank you.